Hi, I'm David Brigati with Texas Healthcare's Fort Worth Bone and Joint Orthopedic Surgery Practice. We're going to be meeting Theresa, age 69, who had one knee replaced at a hospital and the other knee replaced at an ambulatory surgery center. Ambulatory surgery centers are modern, specialized, and efficient healthcare facilities focused on providing high-quality, same-day surgery care to patients at a much lower cost than traditional hospitals and facilitating a more rapid recovery in the comfort of their own home.
You ended up having severe arthritis where you chose to have staged bilateral knee replacement, meaning we did one side and then later we did your other side. So the first one we did hospital-based. It was pretty conventional in Fort Worth, Texas, where you have your surgery at a hospital. That's just kind of where knee replacements are done. And how did your first one go in general?
Well, it was a little bit challenging getting out of the hospital. I wasn't able to get up and do as much as they said I was going to do at the hospital, but overall it was fine. I mean, I healed up just fine and all that kind of stuff.
There is an ambulatory surgery center where we can do this. An ambulatory surgery center is day surgery where you tend to go there. It's a much smaller place. You don't tend to get admitted to the hospital. It's generally all on one floor. And everything is very specialized just for surgery, and there's not a lot, like the recovery and everything is condensed down into what I'll call a few hours.
Mm-hmm.
And so you had your second one for that reason at the ambulatory surgery center. How did that go?
That was wonderful. It was the best experience. Yeah, they got me in and they did it, and when they woke me up, I was able to get up and walk to the bathroom, walk upstairs and down. And I thought, geez, this is great. I should have done it here. And I even made the comment that if I had a third leg, I'd be coming back. The whole experience there was wonderful. Where I can't really say the whole experience at the hospital was wonderful.
And it was actually, I mean, the place we did your surgery is a surgical subspecialty hospital, meaning like it's a very fancy hospital that's designed to be as patient-friendly as a hospital can be.
Yeah.
And so, yeah, you discover what most people discover, which is like big picture. When you do it at a hospital versus a surgery center, the ultimate outcome is the same. Like it's not like it's better because you did it at the surgery center, it's the same. What you tend to find is like at the surgery center, we generally do your surgery early in the morning because you need time to recover. We did yours like at 7 a.m. and usually by around noon or 1, like you're pretty much ready to go home, and then you do the rest of the recovery at home. Same idea as you would at a hospital,
right.
Different, except that at the surgery center, we do put a little bit more resources into having a nurse navigator who calls you day 1 or day 7 after surgery to kind of like just keep tabs and keep some open communication. Well, thank you for answering questions.
I do remember feeling like there was no place like the hospital.
I remember when you were really disappointed when you couldn't do it at the hospital. I was like, I hear you, but I think you're going to like it.
The other place was, I can't say enough good things about it.
All righty, well, thank you. Appreciate your time.